So in fact, we've lost the majority of our eggs before we even start menstruating.
There's a little bit of security because if I go through this process and I'm not ready to have a child now, at least I know in the next couple of years I have that reserve, I guess, of these eggs that are of a certain quality.
Hello everybody, I'm Angie Kent and welcome to the F Chat. The F is for fertility. So we want to encourage everybody to have the F Chat with your friends, with your family, with your doctor. So here we go.
I'm Sam, hello. I am 26. I work in the world of advertising.
I'm Alicia, I'm 34. I've been thinking about my fertility journey for a while and I'm a freelance marketer.
My name's Rihanna, but I also go by Ree. I've just turned 30 and I work in disability and aged care, and this year I'm looking at freezing my eggs.
My name is Eva. I'm a fertility specialist from Brisbane.
When you think about your fertility timeline, what are the main things that stand out to you?
It's tricky because obviously there's and I was told this the other day, there's this misconception that male fertility lasts until you're 70, 75, which is kind of insane to think about it like that. But I think that there's definitely more of a more lazy approach from my gender, especially, just to be like, oh, well, I'm going to be fertile forever, which is just not the truth.
No.
I think for me, probably along with most women, it's age. Just the older you get, I guess the societal pressure is that you have less time, or that's what we've been told, which probably is true as well.
You took the words right out of my mouth. I have to say, as probably a lot of other women, it is age. And I think I've given myself a little bit of a timeline, I guess the next 5 to 10 years.
Oh, it's a very interesting thing what I've just said about male fertility. So may I just say to you now that your fertility does not last forever. And we are now observing quite a significant decline in male fertility. So male fertility contributes to about 30% of all infertility cases that we see now. Now, the perception that male fertility lasts forever comes from the fact that males continue to produce sperm through their life, and therefore they think that if that's the case, I'll just make new sperm and that will last me forever. Now, but that is actually not the case. So you do make sperm, and that is completely true. However, there is a lot of data coming now suggesting that males over 40 are in fact less fertile than those under the age of 40. There is also a lot of data looking now at sperm count and another sperm parameter which is really interesting called sperm DNA fragmentation. But it is definitely interesting that men perceive their fertility to be eternal, everlasting, and not changing.
We've often got that problem. We often think things are eternal. In most aspects of life.
Super men complex.
Now, as far as women's fertility is concerned, you are certainly very right. Age is the primary leading factor in your fertility. But further to that, may I just ask you, what do you consider that age to be? And this is where we start to differ. Because a lot of women don't see themselves as aging, where from reproductive health perspective, they in fact are aging. So women actually age fairly early, and they do have the highest pregnancy rates probably between the age of 25 and 30, where most of us are not really thinking about having children for various reasons. And then after that, we then move on to that 30 to 35, you're still looking at that pregnancy rate being about 30%. But after the age of 35 and towards the age of 40, that decline is quite quick and very dramatic. So when we are seeing women in their mid-30s, they actually don't consider themselves being old. They are young, particularly that we are now living longer, we look younger for longer. So our perception of aging has changed.
Yes, because it's it doesn't matter if you're looking young on the outside, right? You got the Botox, you do the healthy living. This still is aging at a normal speed, which you often don't think about that. You think, well, I look young, I feel young, but your insides are your age, I guess you could put it. When do you think is the right time to start thinking about your fertility?
When I was 25, I was like, yeah, I'll be married with 2 kids at 30.
I know, how funny that we think that as kids. I was like that too, and then you get to 25 and I'm like, I'm just a baby.
Yeah, I feel that way now.
Me too, and I'm 36.
Yeah. After hearing what you said, I feel like I should have rolled it back, and I should
Dr. Eva's like,
I was like, oh.
And this is what it is really, because we are now entering this as I said, a lot of women will come and say to me, and this is actually what they say to me, but I feel so young, and I look young, and look at me, I look good. And I said, well, it is actually not about that. It is about your reproductive health. So going right back to the basics again, because I find that statistics and numbers actually speak to a lot of patients. So when you think about what happens, we are born with 1.5 million eggs. Now, by the time we reach puberty, we have 300,000 eggs left. Oh. So in fact, we've lost the majority of our eggs before we even start menstruating.
How?
Yeah, where do they go?
We actually
no, ask the questions. Do it.
So what happens then? Once you start menstruating, then obviously all the women will then start to lose every month. There will be a recruitment of quite a large number of follicles, not just 1 egg, not 5, but probably about 1,000. Now, a lot of these follicles will then be lost, and single egg will mature and will be presented for that fertilization process. Now, that loss in what we call ovarian reserve can vary quite widely from patient to patient. So we certainly have patients that will lose that reserve a lot slower, but then there will be a group of women that have what we call accelerated loss in their ovarian reserve. And the one thing that I've heard many times from my female patients who spend the entire life avoiding getting pregnant and being on a contraceptive pill and not knowing what the cycle is like, that they stop the pill, all of a sudden things don't look so normal anymore. These are sort of the things you have to consider, that you don't really know what your fertility is like.
So we conducted a survey of 2,000 plus Australians, asking them what they'd like to know about fertility. Our survey respondents had a question for you, Doctor. At what age are women most fertile?
So as mentioned previously, I think the fertility peaks around about the age of 22 to 25, and then it maintains itself at a steady rate till about the age of 30. Now, the fertility rates remain pretty good until about the age of 34. Once you come to the mid-30s, this is when your fertility will start to decline very quickly.
So something to definitely consider in your 20s, which a lot of us wouldn't because we never had education around it. What do you know about egg freezing?
I know that it's a process that is becoming more common in conversation, but to be honest with you, don't know a hell of a lot about it.
I know that you get a blood test to determine the quality of your eggs, and then based off that, injections. And then the injections will encourage the eggs to mature, like a number of eggs to mature, and then from that, extraction and the process of the injections can be really hard on someone's body.
So I went to an information session last year, and I basically went in blind. I had no knowledge prior to what I was walking into. And I think what really scared me in one sense is, even if you go through the process of freezing your eggs, there is still no guarantee, because some eggs during the retrieval might not make it, during the thawing process they might not make it. And it wasn't until I had a one-on-one conversation with the host of the information session where I walked away and I was like, it's not also a guarantee. And I learnt so much, and also about how much pressure our body goes under to do this process as well. And yeah, I was told that 30 is a good age, and not to wait, but also not to pressure myself to do it straight away, but also not to make myself feel bad about not doing it earlier, because I think sometimes we don't feel comfortable having these conversations in our 20s. And so usually when we get to 30 or 30 plus, we start to go, okay, I think I'll look at my options now, but I think it's okay to have these conversations a little bit earlier so that we're more educated on this.
So one thing that kind of struck me in what you said was having a blood test to determine the quality of eggs. Now, this is the one thing I would just like to correct quite quickly. what are you talking about is a test called AMH, or anti-Mullerian hormone. Now, AMH is actually not a test for equality. And in fact, we do not have a test to determine the equality. And what we can say that obviously there are gynecological conditions that we know can affect quality of eggs, but at the same time, women with the same condition have no infertility. So the area is very grey. So when we doing an AMH level, it is mostly to determine and manage the expectations around what's going to happen during an IVF cycle.
Have you ever chatted to your friends about egg freezing? Does it feel like a normal conversation, or is it a little bit awkward?
Yeah, I think it's a big conversation for me at the moment. It's been on my mind for a couple of years now, and my friends are quite supportive of it. I think everyone's on very different journeys. Like, some of my friends have children, some are pregnant, some are starting to start their own journey of conceiving. And I guess for me, I'm just ready to jump in, but it's becoming a normal conversation, at least with my group of friends. And I find that when I meet people as well, I'm not ashamed or embarrassed to be like, hey, what do you think about this? And I love having an open conversation about it.
I would say half my friends have gone through egg freezing.
Oh, wow.
Yeah.
That's a solid number.
It's a solid number. And then the other half of my friends, we will mention our fertility in the WhatsApp chat, maybe like every second or third day.
Oh, I love this.
We're very, we're very much like, where are we at in our menstrual cycle? What's going on with our fertility? How do we feel about
I
this?
need new friends. Have you ever discussed freezing sperm, or, I love this one, sperm donation?
So, no. To be completely honest, no.
We want you to be honest.
But no, it's never come in conversation. But I'm gonna get them all in a group chat, and we're gonna have a boys' day out.
Are you
and
actually going to?
Well, we might do now. No, we don't really speak about it much, to be honest.
Yeah.
There's like a lot of, I feel like, as from the time that I left high school, the conversation around lots of things to do with men's sexual health and just in general has been so much better, and also just a conversation about, you know, men, and the conversation about periods has become a lot less taboo, which is really nice.
Yeah,
and
love that.
because it was for so long, it was just such a, for some reason, it just wasn't something that we spoke about.
No, well, we felt like we had to hide it, so
Yeah.
therefore you guys wouldn't be like, so how's your period?
Exactly.
It wouldn't happen.
You know, like I see now my friends buying like tampons at the store for their girlfriends, for example, which is like a beautiful thing.
This is so good.
Which is great. But definitely in terms of from our perspective, like freezing sperm, no.
I feel like there's not a lot of education around donors and what that looks like here in Australia. Would you agree with that too?
I agree with that.
Yeah.
Particularly, we've had now a lot of legislative changes around the sperm donation program as well. So I think that's another topic in its own. But I think from my perspective, I think I'm now seeing more men coming with the female partners.
Yeah.
And some of them are quite actively interested in asking me, what can I do to help? And which is a new thing, and I think that's a great development, and it's potentially because there is a lot more now available on social media and various other information channels where men can see that they are not just a source of sperm. In my entire clinical practice, I've had one man calling to make an appointment to discuss his fertility.
One person.
One. So we are starting to see men being a bit more proactive about their health. But having said that, they still will come along, and a lot of those guys will say to me, oh, look, I'm fine. There's nothing wrong with me. I know that. And I said, well, what about your drinking and your smoking and your vaping and your cycling? Cycling, a big problem.
Well, I don't ride bikes.
And your gym supplements and all the other things too. So you know, there is definitely still historically a little bit of reluctance on behalf of men to accept that their role in reproduction is actually quite critical.
Do you think that that's because there's shame in it, because they've never been told that it's their problem and it's mostly carried?
I think it stems from the fact that men connect reproductive health to their masculinity.
Yeah, so it does have a little bit of shame
really
there.
is very clear that they do that. So when men find that there's something wrong with the sperm, you can actually see that it makes them almost feel like they're lesser of a man. That is probably the main reason why men don't want to find out.
Do you think egg freezing would reduce pressure, or can it create new kinds of pressure?
I think a little bit of both.
Yeah.
Like from my end of my perspective, it's kind of a double-edged sword. Like, yes, you have that security if you're able to extract a number of eggs. Yeah, I have a bit more time, but then it's also just, I think it introduces a new mental load as well. But you have that security. So
I 100% agree. Like we were talking about this earlier, it's a matter of, when I wanted to start this process, I saw the financial pressure it was going to add. So I'm personally saving for a house deposit, but then I had to start another savings for the egg freezing because, you know, you can do more than one round if you are unsuccessful for whatever reason, or you'd like to get more eggs or anything like that during retrieval, then it all kind of adds up, and then the storage fees on top of it. But it's also, on the other hand, there's a little bit of security, because if I go through this process and I'm not ready to have a child now, at least I know in the next couple of years I have that reserve, I guess, of these eggs that are of a certain quality. So,
what do you understand about sperm health and pregnancy?
I remember, like, we were always taught, for example, like, not to put your laptop on your lap, for example, because it's like the radio, like, or like the heat from it.
I've heard this.
Yeah, it's not all on the women to have their eggs in order. Essentially, it's like it's on us as well. Which
Takes
is
two to tango.
100%. Yeah.
I think that it's around like sperm count and motility as well.
I think it wasn't until you started talking just before, I've never really thought about the sperm side of things. I've been so focused on myself and my own body and my own journey these last couple of years that I never would have stopped to think, hang on, it could also be both parties, like it's a 50-50. And I think I've been so focused on my own lifestyle choices that if and when the time comes, like if I do this with a partner or whether I go by myself, I want to ask these questions about their lifestyle as well. And
well, what is normal in terms of male reproduction, and how do we measure that? And when we look at sperm count, the sperm count is just a number. It is actually not that different to doing an AMH on women. It does give us a bit more information, obviously, because we've got multiple parameters in a sperm analysis. But it still doesn't say whether that sperm will actually fertilize an egg. There is no guarantee that normal-looking sperm with normal count, motility, and morphology will actually lead to a successful pregnancy. So the sperm cycle is about 70 days.
Yes.
So a lot of men that will come to see us will say, well, I haven't drunk for a week, I should be fine. I said, no, that's just 7 days. You've got 63 days to go.
Oh, wow. Okay.
So for your sperm to improve, and that specifically looks at that sperm DNA fragmentation, you need about 72 days before we can see the change. And so that's something to remember. The other thing to remember is there is no safe amount of alcohol. Reproductive cells are the most sensitive to the effects of toxins such as alcohol, and that applies to women and men. So I always say to my couples when I see them, none.
What message would you have for both men and women in their 30s that are looking at trying to have a baby?
The message is that it's never too late. It's never too late, regardless. I think it's important to come and see us when you're considering what to do and when to think about it, and start the conversation.
Yeah.
And the conversation can be started with doing an AMH test. It can be started by just simply having a discussion about what sort of age is a patient in at present, and what to expect in terms of how many eggs do we have to freeze, and then what sort of chances does that give you of having a child. But I think it is really important for women to be informed, and for men also to be informed and understand that they are a very important contribution to the fertility journey.
Woo! Okay, well done, everybody.